I repeat, Kapil Devasi, can you please mute yourself? I guess he's not hearing us.
We will do it from our side. No worries.
Yes, sir. Yes, yes.
Um, 1 second. Yeah, you can unmute your mic and
Yeah,
yeah. Yeah.
yeah, it's done. So, guys, today we are back with another webinar on stroke and its awareness because we, as healthcare professionals, should be the first one to learn how to create awareness in the society. So, to speak on this, we have with us Dr. Ajit Singh. He is the co founder and CEO of Climate Research Solutions, and he's also the National Director for Research at World Youth Heart Federation India. And he's also the principal investigator of the Manipal Heart Failure Registry at Kasturba Medical College, Manipal. So today, this webinar is being conducted jointly by Pharmacy in Short and the World Youth Heart Federation India, along with the Climate Research Solution. So this World Youth Heart Federation, it is an international non-profit organization which it represents youth around the world. They give a dynamic platform to the youth belonging to the, to the individuals belonging to the age less than 35 years. And they have a vision, they envision a world in which, all the young members of the society, they join hands together to provide the better cardiovascular health to the society. And this World Youth Heart Federation, they have 5 working committees representing the acronym HEART, where H stands for Health Education Committee, and E for Entrepreneurship Committee. They have A, Advocacy Committee, R, Research Committee, and T, Technical Committee. And for the Research Committee, Dr. Ajit is the National Director for India. He is also the co-founder and the CEO of Climate Research Solution. Climate Research Solution, it is it is a research solution. They have expertise in providing the highest level of research solution in the field of clinical research, pharmacovigilance, medical writing, and the data analytics. They also have the career consultancies where they have experts who train the young aspirants in the field of clinical research and the pharmacovigilance. And these two organizations, Climate Research Solutions and the World Youth Heart Federation India, they're currently running a record-breaking free certification course on basics of cardiac pharmacology. Registrations are, I guess, still open. You can register. For the link, you can message us. You can also follow us on Instagram, Pharmacy in Short, or the Climate Careers. It's there on Instagram. So let's get started. I now hand over the session to Dr. Ajit to proceed with it. Thank you.
Yes. Uh, Thank you, Syed. Thank you very much for the nice introduction and about the course. Definitely, we have crossed around 10,000 admissions in our course. So still we have, I think, 2 days to get registered, because after 2 days you will not get a chance, because we are done with 4 classes and our first assignment is there on 1st November. So after the first assignment, no more admissions. You will not be allowed to get the admission in our course, right? It's perfectly free course right now, and it is for 3 months. Almost 1 month is over, 4 classes, but you have the flexibility to watch these classes in YouTube and get your attendance done if you registered. If you are registering to the course, okay. So I think without delay, we should start the session.
Yes, yes.
Yeah. Yes. So this session is in the collaboration with the Pharmacy in Short and with our WYHF, World Youth Heart Federation India, and Climate Research Solutions. So this is the first kind of event where all three, famous or well-known organizations are coming together to aware our students. So I think let's start. I will share my screen. Yeah. Is it visible?
Yes, sir. It's
Okay. So, as we all know, today is our World Stroke Day, and that's why we are conducting this webinar on the occasion of World Stroke Day. So this is all about stroke awareness. We will not go into the treatment. I will request again all the participants to mute their mics so it will not cause the inconvenience.
Yeah, guys,
It
it
should
is
not
disturbing a
cause.
lot. I request everyone to please mute.
Yeah, no problem. Let's do it. Let's start. So yeah, so this is all about awareness, basics of stroke. We will not go into deep things. We will not go into the treatment patterns, pharmacology, or pathophysiology. We will just tell you how to ensure if the patient or if anyone is getting stroke in your society, in your family, around you. So we want you to be aware about the condition. We want you to, at least get the first aid done around you in your society, in your family, if someone get stroke, right? So let's start. As we can see here in this picture, in this title picture, there are two things. One is vessel, or we can say vessel blockage. One is vessel rupture. So based on that only, we define stroke into two types. One is hemorrhagic, one is ischemic. Ischemic means when artery gets blocked. Hemorrhagic means when artery gets rupture or burst or leakage, right? So here is the definition. This definition of stroke is given by WHO. I think someone is annotating. I will just block them by annotating, right? Disable annotation for others. Done. Guys, please stop making hearts on the slides, right? Mm, one sec. Yep, done. So let's start. Okay. So this definition is given by WHO. It is like rapidly developing the clinical signs of focal or global disturbances of cerebral function, right? Cerebral function means your brain functioning is affected, where symptoms are lasting within 24 hours or longer, or it may lead to death, where there is no other reason than vascular reason, and there is no other problem like trauma or some other some other causes. It should be purely because of the vascular infarction or hemorrhage that we will check by different modalities in diagnosis, how to check and how to diagnose this. But this is the definition, like where there should not be any another cause, or there should not be any another reason in your brain other than vascular reason, right? And yeah, so now here we have defined the types of hemorrhage, but this is the general definition of stroke. What is a stroke? So it is actually also called, an infarction or hemorrhagic. So in infarction, CNS, the central nervous system infarction, is the brain, spinal cord, or retinal cell death attributable to ischemia. Ischemia means infarction, right? Damage, cell damage, vascular damage, blockage, right? So how we come to know about this damage, about this ischemia, about this infarction, about the pathological conditions, about the imaging, and by the oral, by the other objective evidences of cerebral or spinal cord or retinal focal ischemic injuries, which might be defined as a vascular disturbance or vascular distribution. Okay, and then we have some clinical evidences of cerebral, spinal cord, or retinal focal ischemic injury based on the symptoms persisting more than 24 hours or equal to 24 hours or until death, right? We have to define accordingly. Then actually stroke is a disease that affects arteries leading to and within the brain, right? Within the brain or leading to the brain, where carotid arteries, right? A stroke occurs when the blood supply to part of your brain is interrupted or reduced, preventing your brain tissues from getting enough oxygen, right? So in that case, as it happens in case of heart attack, when you get cardiovascular problems, when you get acute coronary syndrome, when you get myocardial infarction, MI, or heart attack, we say, same case happens in the brain. Your brain part or brain vessels or brain arteries are interrupted, and these are not able to supply the blood to that brain region, and suddenly oxygen level comes down, and brain cells started dying. So that condition in a layman language called stroke, right? Then what are the types of stroke? As we can see in this picture, it shows three types of stroke. One is ischemic stroke, as I was telling, where all the blood vessels are blocked, as we have seen in as we usually see in our cardiovascular problems, as we see in our myocardial infarction, as we see in our heart attack patients. Our you know cardiovascular, or we can say the myocardial vessels, or the cardiac vessels, those got blocked by different pathways, as we are teaching in basics of cardiology, due to maybe atherosclerotic event, or due to maybe some injuries, or then antiplatelet, or sorry, platelet cascade, and coagulation cascade happen, everything. So these got blocked, maybe by the atherosclerotic events, maybe by some other problems. But in that case, only obstruction happens, only obstruction, not the rupture. That's different. Not the rupture or leakage, only obstruction of the blood vessel. And then blood vessel will not able to supply the enough oxygen to that part. So that's why it called ischemic stroke, right? Because this is happening due to ischemia or infarction, right? then
Mm,
then the other
yeah.
type then the other type is, oh, sorry, please. Okay. Yeah. Then the other type is hemorrhagic stroke. Hemorrhagic stroke means when your blood vessel weakens and it ruptures or leaked, right? Due to the weak wall, due to the weak endocardium, due to the endothelial surface, weak endothelial surface, it get ruptured, or it get leaked, you know so that's why the hemorrhage happened, because the blood will come out through that leakage, or through that rupture part, through that injured part, and it will make a clot. It will make a clot. So in that case, the stroke caused by that clot is called hemorrhagic stroke. Then there is another third type, what we know by the name of TIA, transient ischemic attack. Those transient ischemic attack is nothing but just a temporary clot, or we often call it as a mini stroke, or it is a kind of sign of the ischemic stroke, sign of the ischemic stroke or hemorrhagic stroke, mostly hemorrhagic stroke. But it is just a sign, it is just a sign, the simple temporary clot, mini stroke. It is not causing any severe issues with the patient. It is causing just simple issues like swaying, or simple symptoms, normal symptoms like imbalance, or but not the unconscious thing or the severe part, right? So this is called TIA. So these are the general types of stroke: ischemic, hemorrhagic, transient ischemic attack. Simple to remember: ischemic is due to infraction or due to injury by blocking the vessel. Hemorrhagic is due to rupture, due to clot formation. That's why it is hemorrhagic, right? And transient ischemic attack is like a mini stroke, or the starting, or starting point, or initiation of the stroke, right? So here are the definitions of ischemic stroke. An episode of neurological dysfunction caused by focal, cerebral, spinal, or retinal infraction, remember. Or hemorrhagic is due to the trauma, due to the ventricle system or parenchyma, or due to the leakage, but not caused by trauma. It should not caused by trauma, right? Because traumatic is always injury, traumatics are always hemorrhage, but not the stroke, right? So these definitions are by the American Heart Association. Now, here we can see in details stroke, hemorrhagic, and ischemic. So, ischemic, in the strokes, actually, ischemics are 85% and hemorrhagics are 15%. So, most of the strokes are ischemic, 85%, right? So in ischemic strokes, there are maybe because of atherosclerotic events, maybe due to the penetrating artery disease, or maybe a cardioembolic. Cardioembolic stroke is like when you have some cardiac disease and flowing clot, one flowing clot from your cardiac artery, from your coronary artery, comes to your carotid artery and goes to your brain and block the artery. Embolic stroke is due to the cardiac problems, right? So define a definition is here. This is of course ischemic heart, ischemic stroke. But why we call it cardioembolic? Because that that emboli is nothing but a thrombus or a clot which is circulating, and it is circulated from your coronary artery to your brain through the carotid arteries. Through the carotid artery means your through your neck, right? And it is reaching to the brain and causing the blood restrictions or obstructions there in the brain. That's why we call it cardioembolic, right? And there are some other types of, okay, there are some other types. Prutha, well, okay. I just close her mic or his mic, right? Then it is cryptogenic, due to some other causes. There are some unusual causes, maybe due to the prothrombotic dissections, or maybe due to the drug abuse, right? It can happen due to the foreign particles also, correct? So there are the different problems which can cause ischemic stroke or hemorrhagic stroke, right? But atherosclerotic, lacunar, and cardioembolic are the types of ischemic stroke again, right? I think clear here. Then let's go to the next slide. What is the epidemiology of a stroke? In India, we are talking about India here. In India, the estimate adjusted prevalence rate of stroke is 84 to 262 persons by, in 100,000 of our population. In 1 lakh population, there are 84 to 262 stroke patients in rural. But in urban areas, it is way higher, 334 to 424. This is the national stroke registry data, which says why it is high in urban areas. We were discussing few days back about the breast cancer. That day also I was telling the lifestyle, the sedentary lifestyle, the food habits, the lifestyle and food habits, two major two major risk factors which are causing more problems in urban populations, right, in compared to rural populations. Because rural populations are aware, they are working in fields, they are very much exposed to the nature, and they are doing hard work. That's why they are away from these problems, much away, much far than the urban population. So actually the incidence rate, if we look at the incidence rate, common incidence rate, it is about 119 to 145 per 100,000 of the population, right? So the important fact here is, the interesting fact here is, the majority of strokes occur in the people who are 65-year-old or older than that. Almost two-thirds of the global burden of stroke is borne by those in developing countries. Two-thirds is in developing countries. Young adults account for approximately 10 to 30% of all stroke patients in India. 10 to 30% patients of stroke are young adults. What are young adults definition? It should be less than 40 Somewhere it is 45, but in India we consider it less than 40 years of age, young adults, right? So the prevalence is around, I mean, the percentage of the people, young adults is around 10 to 30% in stroke. I mean, with the stroke in India. Okay. So this is about epidemiology. So this problem is not very simple. We have to take care of this. We have to be very much conscious about this problem, right? Okay, next slide. So what are the risk factors? Now I will come to the risk factors. What you all should aware about the risk factors of stroke. There are two types of risk factors: what we can modify, what we cannot modify, right? We can avoid or we cannot avoid. So non-modifiable risk factors are age. We cannot modify, as we say, as we have discussed in last slide. The age, the majority of the patients are 60 or more than 60 years of age, right? Then sex, we cannot modify the gender, right? It is also a non-modifiable risk factor. Then low birth weight. Low birth weight is a risk, another risk factor for stroke. Family history. If the patient's immediate family is having any history of stroke, there are the high chances. Race or ethnicity, there are the certain races like Afro-American or Asians, South Asians, they have the higher chances of strokes, right? And other genetic predispositions like sickle cell disease or Fabry disease or maybe some other coagulopathies, these patients are at the higher risk to get stroke, or they're more prone to get stroke, right? Now we will come to the modifiable risk factors. If the patient is having a history of hypertension, diabetes or dyslipidemia, they are at very high risk to get a stroke. We should be aware in such category, in such patients, about their lifestyle, about their drugs, about their therapies, and about other things, right? So these are the major comorbidities about what, about stroke, so which can influence the chances of getting stroke. Then obesity. If you are obese, you have the another level of risk, another level of risk to get stroke. Then metabolic syndromes. Then your diet and nutrition, it plays a key role. Your diet and nutritional values of your food plays a key role in your health, health aspects. So when it comes to stroke, if your diet, if your nutritional value in the food is not good, is not great, then you are at the greater chance to get a stroke. You are at the high chances. Oh, who was that? Please mute your mics, please. Okay. Then smoking, cigarettes, and alcohol consumptions. Again, these are the risk factors for stroke, for heart attacks, for any other problems also, even for cancer, right? So these two things, two social habits are playing a major role, or we can say taking a major part, or as an etiology for stroke, cardiovascular diseases, for the cancers, right? So but these are the modifiable risk factors. Remember, we can stop these, we can prevent a stroke, right? Right, we can stop smoking, we can stop alcohol consumptions, and we can treat our hypertension, diabetes and dyslipidemia well, and we can keep us away from the problems like stroke or cardiovascular problems, right? Then physical inactivity. Physical inactivity is, it's something a disaster, something disastrous in our society. People are sitting in the offices for hours in a day. They are not going for walk, they are not doing any exercises, they're not doing yoga. They're away from that hard working life. They're away from that hard working life. They are physically inactive, they are in the dormant kind of states. They are just working nowadays in corona. People are not getting time, or people are not getting chance to go out. I can understand, we all can understand, but you have the good time to give to yourself. At you can do the exercise at home, you can perform your daily routine yoga at and other exercises, treadmills at home, right? But you should not be physically inactive. Once you are physically inactive, you will get 100 diseases, and stroke is one of them, right? So if you want to avoid a stroke, you have to be physically active. Then there is another risk factor which is called obstructive sleep apnea. This is the another reason for cardiac problems and for stroke, right? And the major, or we can say the main sign or symptom, or we can say the observation for obstructive sleep apnea is hoarse voice, or we can say what we say, that term I forgot it, slipped from the mind. Mm, okay, if I remember, I will just put in the message, right? So obstructive sleep apnea is another reason for the stroke. Correct. Then next, yeah. So what are the sign and symptoms for stroke? How you will come to know if someone gets stroke around you, in your society, in your family? How you will come to know? So there are 6 symptoms of stroke we can remember by the name or by the term: be fast, be fast, right? Fast, be fast, correct. So B stands for balance. If someone is losing balance, or due to headache or having dizziness kind of symptoms, it could be a symptom of stroke. If someone gets blurred vision, it could be a symptom of stroke. If someone has some facial palsy or some facial paralysis, or face is drooping, drooping of the face, it could be a symptom of stroke. If someone's arm or leg is suddenly getting weak, or they are feeling fatigue, it could be a symptom of stroke. If you are getting slurred speech, or a difficulty in speaking, that could be a symptom of stroke. And now this is the time to call someone, right, in that case. But the patient is itself unable to call someone. So these are the 6 very important and basic symptoms of stroke. Be fast. You can remember by be fast if someone is getting these kind of symptoms, but they do not have any another reason, or they do not have any another problem of these symptoms. Maybe because the imbalance or weakness could be due to other differential diagnoses like hypoglycemia, right? So you have to assess all the things, and then you can define the stroke. Then you can come to know if it is due to stroke or something else. But definitely you should monitor these 6 things by be fast, right? As you can see in the pictures, the facial paralysis in the first picture, it is showing the normal face, and then after the stroke. And in the down picture, in the the down picture, you can see the arms weakness. So patient is not able to put his arm up, right, to keep his arm up. So this kind of sudden weaknesses happens due to paralysis of nerves, right, in the stroke, because your brain is not working properly due to the insufficient oxygen supply, right? Now here, very interesting, there are the symptoms difference in males and females. Very much difference. Very much difference in symptoms and signs in females and males. So as we can see in the right side picture, women can face can face the face drooping, arm weakness, speech difficulty or slurred speech, vision problems, trouble in walking or lack of coordination, maybe severe headache without a known cause, right? So these 6 symptoms could appear in even men, right? But women have some different symptoms which are not appearing in men, right? These are general weakness, disorientation or confusion, or maybe memory problems, fatigue, nausea, and vomiting. So, right. So these are the extra symptoms we should be aware about the females. As we can see in the left picture, there are the numbness in your face, arm, and leg. Women can face the numbness or the weakness, right? In the brain, if we look at the brain, they will be confused, there will be trouble in talking, slurred speech, or you can understand by the speech. They will feeling dizziness, loss of balance, they will have the bad headache, right? If you come to the eyes, they will have the blurred vision, right? Trouble seeing in one or both eyes. So it could be one sided, it could be both sided, right? Stomach, they will have some throwing up or GERD kind of symptoms, or urge to throw, the throwing up kind of symptoms, right? The whole body will be feeling tired, and they will have trouble in walking, right? Due to the excessive fatigue, they will be they will be having some trouble in walking, right? So these are the additional symptoms in the women in compared to men. So, right, so I think you are clear with the symptoms. Now, how to give the first aid, how to give the first aid, and what are the chances? So there are two types of casualties, there are the two types of emergencies. One is conscious casualty, one is unconscious casualty. In conscious casualty, the patient will be conscious, but in unconscious casualty, patients will not be aware of the surroundings, about the environment, about the people around the around the patient. They'll not be aware of anything. But in conscious casualty, they will be knowing, they will be facing the symptoms of paralysis, they will be facing the symptoms of slurred speech, blurred vision, but they will be conscious, right? So in that case, what we should do, we should in conscious casualty, we should support them on the head and shoulder, we should keep on the pillow, right? We should lose their tight clothes, we should lose their we should lose their shirts, or their jeans, if they're wearing, if they have any tight clothes, we should remove them immediately. We should clear the way for we should clear the airways for them. We should take them to the open areas, clear and open areas, right? We should wipe away all the secretions from their mouth, whatever is they have some special, they have some secretions from their mouth. In that case, maybe saliva or other elements. So we should wipe away those things. We should maintain the body temperature. How? Wrap the casualty in a cold wet sheet and keep it wet, you know to maintain the temperature, to maintain the body temperature. So let's read it. You can see in the uh, text also. Move the casualty to a cool environment and remove as much as of his outer clothing as possible. If the casualty is conscious, place in half sitting position, as we can see in the picture, conscious casualty, right? If the casualty is unconscious but breathing normally, place in the recovery position, a lying down position, recovery position, right? Wrap the casualty in a cold wet sheet and keep it wet, right? Once the casualty's temperature appears to have returned to normal, replace the wet sheet with a dry one, right? Monitor and record the vital signs. In case of the stroke, major part is blood pressure, and temperature. You should monitor these two things frequently, every 10 minutes, or every 20 minutes, or every 30 minutes, because these are the two things suddenly changes in case of stroke. So this is the first aid kind of things. If you have, you should not be in rush to get the patient to hospital alone. First, make the airway clear and make the patient stable, then only rush to the hospital in such cases. It is very much important, and written in the guidelines, you should not be in hurry alone to take the patient to hospital, right? Okay, then what are the diagnosis algorithm? If the patient is getting sudden symptoms or signs of stroke, first check the stroke mimics. As I told you, there are differential diagnoses which can cause stroke type of symptoms, stroke kind of symptoms. Like hypoglycemia, patient can get imbalance, slurred speech, blurred vision, right? Migraine headache also can cause that kind of symptoms. Or if the patient is, having seizures, he can or she can get that kind of, stroke symptoms. So first determine or check the stroke differential diagnosis or mimics, then only go for the eligibility check. So if you find anything which is mimicking the stroke, or which is the differential diagnosis of a stroke but not exactly stroke, then treat accordingly and reevaluate. If your stroke mimics excluded, means you feeling this patient is stroke only, then perform neuroimaging, maybe computed tomography CT, or maybe MRI, brain MRI, or head CT, right? Then based on that, you should define, or you should identify whether it is an intracranial hemorrhage or whether it is ischemic stroke, right? Ischemic stroke or hemorrhagic stroke, right? If your hemorrhagic stroke is excluded, then work on the acute ischemic stroke treatment, and that is everyone knows that this is plasminogen activator. Plasminogen activator, what we give in acute stroke cases, that is alteplase, right? Alteplase, I will come to that. A basic treatment in the emergency strokes, alteplase, right? So if, but remember, alteplase is not at all recommended in hemorrhagic stroke. So you have to identify what kind of stroke it is, whether it is a hemorrhagic stroke or whether it is ischemic stroke, right? When it is a hemorrhagic stroke, we have other treatment options, like other anticoagulants, or other treatments are there, rehabilitations, and surgeries, right? But acute ischemic strokes, we can go for plasminogen activator alteplase for immediate treatment. Then we can go for antiplatelet drugs, right? Later, if these two are excluded, history and physical examinations are suspicious for subarachnoid hemorrhage. Subarachnoid hemorrhage is something which is in the very less percentage, less than 1% of the patients get subarachnoid hemorrhage. That is when you get clot, not exactly in the brain, between the brain and your palate. When you get clot between your brain cells, or brain tissues and palate, this is not exactly hemorrhagic stroke. This is not exactly the hemorrhage in brain, but this is due to unknown cause. But there are the clots in subarachnoid area, right? In that case, you have to perform the lumbar puncture and you have to remove the clots, maybe by lumbar puncture, or if it is major or severe, we can go for surgery. Now next, what is the monitoring and therapy? Mm, so alteplase, as I told you, in that case we should monitor BP or neurological function or bleeding time. you know Frequency, every 15 minutes we should check for 1 hour, every half an hour for next 6 hours, and every 1 hour for next 7 hours, right? Then every shift, like every 6 hours or every 7 hours. So these are the frequencies to check these parameters in case of alteplase, if we have given for at least next 2 to 3 days. After that, we have to give at least one antiplatelet drug. Preferably, it should be clopidogrel, not aspirin, because aspirin has the higher bleeding events and higher recurrence in case of stroke. Okay, so sorry. In case of stroke, patient has the higher chances of recurrence if we are giving aspirin, not clopidogrel. But preferably, we should give clopidogrel in that case. And third, another antiplatelet drug is dipyridamole, ERD, extended release dipyridamole. But it causes headache and it has high bleeding profile. You know, Bleeding profile is really high. So we should avoid that. Correct. We have to give warfarin also in case of hemorrhagic stroke. Warfarin we can give as a anticoagulant drug. In that case, for first 3 days we should check INR daily, then weekly until the patient is stable, and then monthly, right? In case of warfarin. So how to prevent the stroke? If someone gets the stroke around you, if someone gets the problem, if someone is there on the problem, someone is there in the symptoms or something, how to prevent it? Or before getting a stroke only, how to prevent? 80% of strokes are preventable. Remember, 80% strokes are preventable. How? Keep your blood pressure low. maintain your blood pressure. There are certain guidelines which are saying what to avoid, what not to avoid. So you have to maintain your blood pressure. You should not get hypertension. If you are hypertensive, maybe by genetically or hereditary or due to some other reasons, you should maintain your blood pressure. Your blood pressure should not raise, right? You should maintain or keep your cholesterol at the lower side always, your LDL or triglycerides, or you should maintain your HDL. You should keep at the higher side, HDL, right? So you should maintain your cholesterol levels. You should always eat healthy with sufficient nutritional value, right? Always eat healthy, avoid junk foods, avoid the outside foods and all. And why I was talking about this rural and urban areas, because urban areas, they are not more keen to eat the homemade foods. They are not keen to eat fresh foods, and they are not actually getting the fresh foods. But in village, people are getting fresh foods from their own fields, from their nearby neighbors field, or from the nearby markets, and they're getting the fresh foods, right? That is more important, to eat healthy, to avoid all kind of problems including strokes, right? Then exercise regularly. You have to exercise regularly. You have to go for walk, run. You have to do the certain yogas and pranayams to avoid certain problems including strokes, right? And then you have to treat your sleep apnea. You have to treat your sleep apnea. Then manage your diabetes, as diabetes is another risk factor for stroke. You have to maintain your sugar levels. If you are diabetic, you have to maintain your sugar levels. You have to take your medicines daily. You have to take very specific medicines, but you have to maintain your sugar levels. It should not raise. If your sugar levels are going high, you are increasing your risk to get stroke, right? Drink in moderation. Do not drink frequently if you cannot quit. Otherwise, quit it, right? Stop smoking. Avoid unnecessary stress of work, of family, anything. Avoid unnecessary stress. You should not have unnecessary stroke. If you have unnecessary stroke, you will get you are at the higher side, higher risk of getting stroke. Maintain an healthy weight. You should not be low weight, or you should not be at the obesity level, right? So let's read the plan. What is the six point stroke prevention plan? Keep your blood pressure under control. As I was telling, the ideal for healthy adults is 120 by 80 millimeters of mercury. If you have high blood pressure, work with your doctor to reach your treatment goal. So keep your blood pressure regularly in control. Number two, exercise moderately for at least 150 minutes in a week, ideally 30 minutes a day. Ideally 30 minutes a day, but at least 150 minutes a week you should exercise. Leisure activities and chorus count too. You can go for run, you can go for walk, you can go for jog, but it should be continuous. You can go for brisk walk, you can do some light cardio exercises, but you should do yoga, you should do pranayam, but you should not avoid those things. You have to be active. Your body should be active in that case. Okay, then number three is eat a nutritious plant based diet. Avoid red meat. You can include occasional lean red meat, but not always. But not always. You can eat fish at least 2 times a week, and skinless poultry, you know, is recommended. Skinless poultry is recommended, but red meat is to avoid, right? Consume more than two standard alcoholic drinks per day. If you are too much alcoholic, A standard drink is 5 ounces of wine, 12 ounces of beer, or 1.5 ounces of 80 proof liquor. They have given completely. What's the point? Stroke prevention plan? I think you all are now aware of these things. Let's do it. If you get a stroke, rehabilitation is the best plan. Rehabilitation is the best plan to get yourself come back to your normal life after a stroke, because in the stroke your body is weakened, your you will get the body paralysis, you will get the system paralysis, or then in that case rehabilitation is very important. You should keep a physiotherapist at least for 3 months. Frequent physiotherapy is needed, frequent rehabilitation is needed in stroke patients, and this is the best idea to get the stroke patient recovered along with the treatment. Maybe it is clopidogrel or some statins or anything whatever is prescribed by the doctor based on your condition. But rehabilitation is another good source or good plan to get recovered easily or faster than other things, right? Okay, next. I think we are done. So today is our World Stroke Day. You can join our World Youth Heart Federation uh, uh, in our movement, in our campaign, and we are associated recently with Public Health Federation of India, that is well known, and the government federation, PHFI, Public Health Federation of India. We are running this campaign. You can join us in our Instagram pages, in our websites. So I will say thank you very much, everyone, to join us. And I think you are now aware of the stroke, their symptoms, and what to do and how to do. Right? So
Yeah.
let's come to the questions. We can discuss the questions further. Okay, I'll
Yes.
just. Yeah. Yes, guys, if you have any question, you can ask.
So
Okay,
we have a question.
let's let's
Yeah.
go through the let's go through the these questions. So here is our course. एक minute, one sec. I'll just yeah, I'll share now. Here is our course. Okay. Now I'll go to the chat box and clear out the questions. So, okay, thank you, Manvi. And next is from Manvi. How do clot flow? See, if clots are very small, that is called emboli. Clots are actually stable. So in that condition, we call them thrombus. If they are stable in the coronary artery or somewhere in any artery, we call them thrombus. But if they are not attached to a big clot or not attached to any artery, then we call them emboli. And these emboli flow with the blood as RBCs and other blood components flow. Same, our clots, which are called emboli in this state, are flowing in the circulation and reach to your brain and cause the problems, cause the infraction there, or cause the blockage there, right? Okay. Use of technology more in radiation than that causes diseases. Yeah, this could be a reason, another reason. More radiations that can cause stroke. Again, this is a risk factor also. Yeah. Then Shweta has some question. Low body weight aids to stroke. Okay, definitely. See, low body weight has the lean problems, because in that case, your lumen or your endothelial in low body weight patients, endothelium is very weak in that conditions. In low, I mean, very weak means in compared to the healthy participant or healthy human, low body weight candidates will have the weakened lumen or endothelium. In that case, there are the high chances of hemorrhagic stroke. Okay, so Manvi Mittal, again a question. If a patient comes, how can we differ between heart and brain stroke? Of course, by imaging. we have to check the imaging, maybe MRI or maybe CT head, right? Then only we can differ, and we can check out about the cardiac problems. If they have the additional cardiac problem, we can go for ECG or echo, right? Stroke, sir, is in brain stroke and myocardial infarction somehow connected? Yes, because see, myocardial infarction and stroke, ischemic strokes are having same pathology, same generation. In that case, as I was telling, just I was describing the emboli which are generated, which are actually detached from some coronary artery. Cardioembolic stroke, they flow with the circulation, and they go to the brain and settle there and cause ischemic stroke. Like, there any risk to heart of person who had a stroke? um, it is not exactly vice versa, but yes, stroke patients are having more prone to get heart attacks or myocardial infarctions, because they have the hypertension, they may have diabetes, or they may have they are on the drugs, or they have the infraction somewhere in the body, in the brain, so they will have the chances to get infraction even in the cardiac coronary arteries. Why do we keep the environment cold? To maintain the body temperature. In stroke patients, body temperature raises, body temperature raises suddenly. They get panicked, and the body temperature raises in that case, pathophysiologically. So in that case, we need to keep them cold, not the exact environment, but we should wrap them with the wet sheets. Sleep paralysis can cause stroke, but I'm not 100% sure, Sridevi. um, Next is, how low body weight are risk stroke. Okay, I just told. Can we take same anti-cholesterol drugs for more than a year? If they're effective, yes, we can take for 5 years. We can take as long as we want. It is up to us. If they are, if we are, tolerating the anti thrombotic, or we can say anti-cholesterol, we can say statin therapy. If we are tolerating the statin therapy, we can take as much as we want, or as much as required. Yeah, if the patient is not having risk factor, also they can get sudden stroke, maybe due to stress. Yeah, bystander ask because due to the stress, due to the unnecessary stress. Red meat will increase your cholesterol PC, cholesterol levels, and that's why it can cause the stroke. It is a risk factor. Red meat has the high level of cholesterol. I mean, it will raise your cholesterol level suddenly, and it raises. It is proven. No, we do not have same plans, Prezi. We do not have same plan for ischemic and hemorrhagic stroke. We have different treatment plans, completely different treatment plans for ischemic and hemorrhagic stroke, because these are different. Yes, along with the antiplatelet therapy, if the cholesterol levels are high, we use statins in stroke management. Stroke patients recover fully. Yes, stroke patients can recover fully, but they have to be on anticoagulants or antiplatelet drugs based on the type of stroke. How to identify asymptomatic stroke? Asymptomatic stroke is something which is very rare, but of course, if you do not have symptom, you will not go to clinician. And asymptomatic stroke can be identified only by the imaging, only by the CT brain, CT head, or MRI brain. As a being of non-specialist, very interesting question, Bhumika. As a being non-specialist, how can we help a stroke survivor to regain their ability of thinking and speech? Physiotherapy, or you can make them able to exercise more at home, or simple massage you can give at home. You can read from the internet little bit, exercise, yoga plans, and their diet modification plans. And the massage is very important. Physiotherapy or rehabilitation is very much important, so you can do that at the home also with to the patients or the survivors, stroke survivors. Blood thinners are not reason for hemorrhagic stroke. If patient is on blood thinners, it could be a reason, but not exactly in the patients with the other problems. Does liver damage can lead to stroke? I'm not sure, Hemlata. I have to read it, and then we will get back to you. Tenecteplase is not at all preferable in stroke patients. Only alteplase. Tenecteplase is the secondary or tertiary choice. Tenecteplase is not a first choice. Alteplase is WHO recommended and FDA recommended. FDA has approved alteplase for stroke. Only alteplase. Okay, now I will come to the YouTube to check the questions there. If you can check out Kamran, if you can see there.
Yeah, I was just checking. We had a similar question there by Pavani Chaudhary, I guess. She
Okay.
asked, the person is asking if the patient is having the transient ischemic stroke, so how
Okay.
long will it take to recover fully?
It depends. Usually, it takes 3 to 6 months, not fully exactly, but yeah, partially. You can get the effect of physiotherapy and rehabilitation within 6 months. 3 to 6 months. Okay, and then
There is one more question. The person is asking, like, if we keep the cold environment, will it affect the clotting? Because the patient is already having a clot, and if we try to give the cold environment.
see, it is not exactly cold. Exactly cold means, see, it is not exactly cold. That means to just, reduce down the patient's temperature. It is not like you have to keep the patient on ice. It is like you have to maintain the room temperature or less than room temperature, a little cold, like 15 to 20 degrees. So it won't affect much. Definitely, it won't affect much.
Yeah, there is one more question. Uh, the question, wait, I'll just read.
In YouTube?
Yeah, yeah, it is on YouTube. So, are there
Okay,
chances?
okay.
Okay, are there any chances of this clot in the brain affecting the other parts of the body? Like, are there any complications from the stroke?
Yeah. Patient can get, yes. I just forgot to tell you guys. There is the high chance of getting pulmonary embolism (PE) that could even lead to death. So pulmonary embolism is another complication of a stroke. If you get a stroke, you should be very much aware. That's why we give alteplase in emergencies, because this can cause pulmonary embolism in the patients.
So, I guess there are no more questions.
Okay, so guys, there is little announcement from our side. Uh,
Yeah, yeah.
can we see our slides are visible?
Yes, they are visible.
So we have introduced our course, medication complexities and errors. This is our premier course, and this is the third batch. First two batches, which we have conducted in June and August, was very much successful, and many people have attended these. There were house full. We can say all the seats were completely full in previous batches. So after many requests, we have introduced this course again with the same fees what we kept in the last batches. And this course is starting on 22nd November. The last date to register is 10th November. You can register by this link. And yes, we have almost 4 to 5 faculties who will teach you for 45 days, 12 classes, 10 classes. We have faculties from Ireland, from Canada, from India, and I'll be taking your medication complexity classes. And there is no one in India who teaches medication complexities. We are the only, CLIMED is the only have the right. This is our copyright course where we teach medication complexities, guys. Okay, and as another thing, I'll just yeah. So this is our international career and opportunities e-workshop on 8th November. You can even register for this. So I feel thank you very much. If you have any questions, we can go for any questions right now.
Yeah, well, I'll just make an announcement regarding the certificates. So, guys, you
Yeah.
don't have to worry. For those of you who have already registered, you will be getting the certificate to your registered email ID within a week. And if you have any other queries, you can reach us on Instagram. We are active on Instagram. You can follow us, Pharmacy in Short or Climate Careers. You can follow us and you can ask us. Within a week, we'll provide you the certificate. And one more good news to all of you is that today at 9:30 p.m. Indian time, we are conducting a quiz on Instagram. It will be on stories. The quiz will be active for only half an hour, and whoever answers all the questions correctly, they'll be getting a special certificate and recognition from Pharmacy in Short. So you can follow us on Instagram, and you can also follow Climate Careers.
Am I
So thank
eligible?
you so much. Yes, yes, of course, Doctor.
Okay.
Yeah, and also I'd
Thank
like to
you.
thank Dr. Ajit for giving your valuable time. It was really a beautiful presentation. It was very interesting.
Yes, thank you very much. And it was a very fantastic, I feel people should know about this stroke, and that kind of things should be done to the public and to our students, so they will be knowing about these conditions, and they can help the society, they can help the people nearby in their family. If they get certain problems, they should be aware, and at least they can give the first aid, and they can recognize that what condition it is actually, right? So
Yeah,
in that case, we really need to aware them about the conditions. So thank you very much all for joining. I think we get a good number, and your certificate will be provided within a week, so do not be in a hurry, right? And of course, yes, thank you very much, Said. Thank you for
yeah. Thank you,
conducting such
Doctor.
webinars. Yes, thank you
Yeah,
very
thank you
much.
so much
Okay,
for conducting
it
with
was a
us. Thank,
wonderful webinar. Thank you all for joining. Chalo, bye
thank
bye,
you,
see you, good night, bye bye
thank you,
guys,
guys.
good night.
Good night.